Hello everyone, my name is Jessie Predieri and I'm comparing healthcare in the United States to healthcare in Sweden. So in the United States, the healthcare system is a mixture of both public and private insurance plans. The healthcare services are provided through a combination of federal, state, and local government, and the system is not usually described by the words cost efficient. The Affordable Care Act states that the government, employer, and an individual have shared responsibility for ensuring that all Americans have access to health care. Similarly to the United States, the healthcare system in Sweden is also a mixture of both public and private insurance, but it does tend towards universal health care coverage. All three levels of Swedish government, including the Ministry of Health and Social Affairs at the national level, 12 county councils at the local level, and 290 municipalities at the regional level, are involved in the healthcare system. The 1982 Health and Medical Services Act states that all legal residents must be covered by the healthcare system. The Swedish health system is mainly funded through the government and is decentralized, but there is some private healthcare insurance that is used as a method of supplementary coverage for some individuals. In terms of population health, infant mortality is an excellent indicator for the level of health in a country. In the United States, the infant mortality rate is 580 deaths per 100,000 live births. In Sweden, the infant mortality rate is 260 deaths per 100,000 live births. In simpler terms, this means that there are 2.23 times as many infant deaths in the United States as there are in Sweden. The total healthcare spending per capita is a good indicator of the amount of healthcare spending in a country per year. Total health expenditure per capita is the combination of both public and private healthcare spending as a ratio of the total population. So in the United States, the average amount spent per capita is $9,403 versus Sweden, where the average amount is $5,488. So you can see here on the chart that while Sweden and the United States both are on the tail end of the chart in terms of healthcare spending, there is a large gap between Sweden and the United States. So the concept of preventable deaths is based on the idea that certain deaths based on age group, specific disease, socioeconomic status, etc., could be avoided if proper health investigations have been taken place. So a death can be considered preventable if it could have been avoided by public health interventions, which focus on wide determinants of public health, such as behavior, lifestyle factors, socioeconomic status, environmental factors, and things of this nature. So in the United States, in the year 2013, there were 115 preventable deaths prior to the age 75 per 100,000. In the United States, the 5 leading causes of premature preventable deaths are heart disease, cancer, chronic lower respiratory disease, stroke, and unintentional injury. In Sweden, in the same year, 2013, there were only, prior to the age of 75, there were only 72 deaths per 100,000. So in Europe, nearly 3/4 of the preventable deaths are attributable to heart disease, lung cancer, accidental injuries, alcohol-related diseases, suicide, and various cancers. So now I'd like to move on to public and health prevention. So sexually transmitted disease prevention and control efforts are incredibly important for public health prevention efforts in a country. In the United States, a Planned Parenthood poll of 2012 shows that sex education for middle school and high school students are supported by 93% and 96% of parents respectively. In the United States, however, sex education programming varies widely from state to state, as decisions on how and when sex education should be taught are often left up to the individual school districts. So the Affordable Care Act has had significant implications on STD prevention because it has included increased access to preventative services, prescription drugs, and wellness tests. However, with this lack of sex education in schools, our sort of aura about like STDs and that sort of thing is not quite as liberal as in Sweden. So in Sweden, family and sex education has been taught in schools dating back all the way to the 1950s, and there is a national strategy against STDs such as HIV and AIDS, which is implemented by the Public Health Agency of Sweden. This organization can allocate grants and things of that nature for preventive initiatives against STIs at the national, regional, and local level. And Sweden's sex education, like I said earlier, is a lot more in-depth and quite a bit more liberal than it is, than that type of sex education is in the United States. And the subject is usually taught for a minimum of 3 weeks to late middle school all the way through high school students. Okay, so physical environment. This is incredibly important for a population's health, and it can be heavily influenced by the quality of the physical environment. So in terms of air quality, both the United States and Sweden rank pretty high in terms of air quality and among nations with the lowest amount of air pollution. So a key indicator used to measure air pollution is PM 2.5. The PM stands for particulate matter, and the 2.5 means a particle of 2.5 microns in diameter or smaller, which is about the size of a single bacterium. So when the PM 2.5 levels raise too highly, it can negatively affect the air quality in the population and in that country. So, and that obviously is going to take a toll on public health because air quality, everyone's going to breathe the air. So if it has, a lot of particles in it, a lot of bacterium in it, the public health of the population is going to suffer. So the United States and Sweden were ranked 8th and 6th respectively in levels of the particulate matter 2.5 that I was just talking about. Additionally, the United States was ranked 82nd and Sweden was ranked 95th in pollution index, this was in 2018 out of 98 countries. So this means that both the United States and Sweden came in the 83rd percentile for air pollution. So this is pretty good. I mean, Sweden is just a little bit better than the United States, but they're both pretty comparable in terms of the public health from air pollution and the environment. So, access to care. This is a big one. In terms of access to care, the United States and Sweden differ in the number of practicing physicians in primary care and specialty care. The United States has 256 practicing physicians per 100,000 people, compared to Sweden, which has 401 practicing physicians per 100,000 people. So this physician-patient ratio is very, very important, and it can have a significant impact on the access to care of a nation's population. And it can also impact the quality of care provided to those who do not have access to the primary care physicians, or when the primary care physicians have very low staff to patient ratios and they have to try to see tons and tons of people. So the social and economic environment, this can be heavily affected by the unemployment rates, and this can be a huge indicator in the health care access that in a country, because if people are unable to work to make a living wage, they're not going to be able to afford health care. So the unemployment rate measures the number of people actively looking for a job as a percentage of the labor force. In the United States, the unemployment rate as of 2018 is 4.1% of the population, or 65.85 per 100,000 people. In Sweden, the unemployment rate as of 2018 is 6.3% of the population, or 3.37 per 100,000 people. So all in all, there are some key similarities between the healthcare systems of the United States and Sweden, but there are also some stark differences that truly separate the two. For starters, the differences between access to healthcare in the United States compared to Sweden make the United States look far behind in the terms of healthcare restructuring and improving. So in 2013, only 6% of adults in Sweden reported a barrier to access to healthcare due to cost, in comparison to the United States, which had 37% of adults. That is just an astounding number, 6% compared to 37% of American adults reporting that they had issues with access to care due to costs. Much of this access barrier comes from the fact that the United States is a lot more privatized than it is universal coverage, where Sweden is nearly 60% public and only 40% privatized. The statistics, because of the lack of access in the United States, speak for themselves. The infant mortality rate in Sweden is less than half of what it is in the United States, and there were 43 more preventable deaths in Sweden in the year 2013 than there were in the United States. These improved statistics for Sweden are not reflected in healthcare costs, however, as the total health expenditures per capita are less than 60% of those of the United States. It is clear that the United States is spending way too much money in a much less efficient way than they are in Sweden. Access to care is the measurement that differs the most between the two countries, and it is clear that the United States needs to reintegrate healthcare in a way that allows more people to have access to good quality care, as the people of Sweden are lucky enough to have. So I've got my references for you, and thank you.